want a non-surgical facelift, well, PDO threads can help you achieve a lifted face without undergoing the knife. So I'm going to show you a typical PDO thread lift. So I have numbed our patient up here, so to help with at the insertion spot of where I'm going to put the threads. Okay, just checking again. Can you feel that?
No.
Okay. And so we're going to make a little pilot channel right here. Beautiful. Beautiful. And we are using Nova threads. And these are barbed threads, really help pull up. So I'm going to go in through my place. Okay, you ready?
Mm-hmm.
1, 2, 3. Here we go. Push, push. You're doing amazing. Awesome. So this is great to help lift nasolabial folds, jowls, full faces, neck. You could do breast. You could do knees. Anywhere you want lifted, we can do. Okay, I'm gonna go up top again. As our patient wants her eyes a little lifted too. Okay, up a little higher. Here we go. Boop, 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 boop. You're doing so good. Okay. Awesome. That's so great. How's that feel? Does that feel like it's pulling?
Mm-hmm. Yes.
You're doing great. Okay, awesome. Okay, we're gonna keep on going down. Generally, I like to use anywhere from 5 to 8 threads per side. And it doesn't take very long. Very effective. So these will dissolve over the course of 2 years. So the entire time, going down now, the entire time they are in, they're gonna make you make collagen. Ooh, I love that one. That's always the best one right there. It's also the most painful one to get in, but you have some kind of disposition where your pain tolerance is high. Okay. I'm gonna go down south again. Ready? 1, 2, 3. So I always call this the procedure that keeps proceeding, because the whole 2 years that these are in, they're going to be making you make collagen. You doing okay?
Mm-hmm.
I sometimes feel like this is the worst part, is the massaging part. But evidently not for you. Okay. All right, so now I'm going to go along your jawline. Can you feel here?
Yes.
You do feel as a pokey?
Yes.
How about here?
Yes.
Oh, okay. That's emphatic. Let's do a little bit more lidocaine. Ready? 1, 2, 3. Lidocaine with epi. So these threads are on it's a blunt tip. So I don't know if you can see that. I cannot get in, I can't poke myself with these. So I need to have a pilot channel to get into the skin. So you can see it's blunt. That's why we do the lidocaine with epi, and then use a little pilot channel, a little needle to make a pilot channel, and then put those threads in. So if you're wondering why we're doing a pilot channel, that's exactly why. The nice thing about these two is that as I'm gliding through your skin, I'm irritating the cells that make collagen because it's a blunt tip. So it just irritates, might be irritating you too, but it definitely is irritating your cells. Can you feel here?
No.
Oh, good. I love lidocaine. Beautiful. Okay. And there. No, sorry. Alrighty. Go right along your jawline here. Let's move your little hairs out of the way, sorry. Little wispies. Okay, here we go. Hold, please. There we go. Okay, along your jaw. There you are. You're amazing. You're so strong and brave. Good job. Yeah, love that. And then I always love to do two. I like to do them evens and evens because then you can twist them together and just give yourself a little extra pull. Okay, this one's going to end up right under your chin. A little extra lift there. You are so great. I wish you were my patient every day for these. Though you might not wish you're here every day for these, but that's great. So now I'm just kind of fastening them into your skin. I feel like sometimes that's the worst part. I'm going to twist them to give you even more pull here. Just a couple of ways. Okay, and now I'm gonna cut the ends so you don't get to keep those threads hanging out like that. And we're gonna pull the skin right over them like that. And look, you're not even gonna know if she had anything done. I know, isn't that great? So I'm gonna do one more. I'm gonna do that one that goes up, the one that you said didn't hurt on the other side. So let's keep that same thought process. It's not gonna hurt. Okay. Where's that other? Hold on one sec. Where did I put that other little thread? Hold on. It's in here. It'd be nice to have 4 hands, I think.
The
Okay.
Octomom.
Octomom, yeah. Okay, turn a little farther away from me. You got it. There we go. Okay, now I'm gonna go up, okay? Sorry, okay. You okay there?
Mm-hmm.
Okay. You're doing great. These are called infinity threads. Slightly a little different, but they're still out of the Nova thread family. And I like to use these for what's called the reverse vector. You'll understand what I mean when I see what I do with it. Okay, beautiful. Awesome. Always, the barbs always attack my gauze. Rude. Okay. Doing okay?
Mm-hmm.
Okay, beautiful. We're gonna get rid of. I love this one because it just helps to snatch that. Yeah, jawline. Okay. And there's really no limit to the number of threads that you can do. It's limit by how much the patient will let you do. Sometimes people ask, they say that if they're thinking of doing a facelift, I want to do threads like within a year of doing a facelift, but 2 years of doing a facelift, it's totally fine. If a plastic surgeon tells you you can't do threads before doing a facelift with me, then find another plastic surgeon because they can work around these threads, especially if you're doing a deep plane facelift. Oh, beautiful. I know plenty of plastic surgeons that incorporate this into their practice too, so if they didn't like them, they wouldn't use them themselves. Okay, give me a smile. Okay, great. I always like to check to make sure we cannot see any of them, and we cannot. This isn't for everybody. If you have really thin skin, these are not great. Our patient has beautiful skin, and it's nice and thick, so I don't worry about these threads. Now, there are thinner threads we could use if she had thinner skin, but she has really nice thick skin, so I like to use the ones that are really strong and last for 2 years. Personally. Okay, you love that? Does it feel like I'm pulling you up though? Sometimes people like that feeling. Okay, so let me cut these. And these are made of polydioxanone, which is the same thing that surgeons use in the OR. Or if you had like a laceration and you got sewed up in the ER and they said don't bother to come back, those are going to dissolve. This is the same material. So I've been using this material forever, for a really long time. So candidates, we talked about people with better skin. If it was too crepey here, I wouldn't have her do it. But otherwise, I mean, most people are candidates. I don't think there's anything underlying that would prevent you from being a candidate. The aftercare, because what happens is these threads are going to be surrounded by your tissue. So if you were planning to run tomorrow, you're going to jiggle these threads, and they're going to come down before you have time for your tissue to encapsulate them. So I tell you no jumping for about 2 weeks. I don't want your pet licking the entry wounds either, or I want you to change your pillowcase tonight, make sure that's nice and clean.
It's already fresh.
Oh, good. good. Oh my gosh, you're amazing.
Fresh sheets, fresh pillowcases.
Oh, I love getting into bed with fresh sheets.
Yes.
Oh, yeah, that's my
Mhm.
favorite thing. And then if you, sometimes people feel what's called zingers. If you get one, you'll know what I mean. You'll be like, oh, that was it. It doesn't mean anything's broken. I haven't had any threads break. It just means that as the tissue is surrounding your skin, maybe a little tiny nerve has gotten wrapped up in there, and it'll just zing you, and then you'll be like, oh yeah, I remember I got those threads, and she told me about the zingers, and then it's gone. And it might happen for a couple days. It might happen not at all, but I always like to warn people. You are going to be sore. So I always tell people no big, huge, heavy laughing. Try not to laugh at all my jokes. I know it's really hard because I'm very funny, but no big like mouth movements. If you're deciding you're going to have a hamburger tonight, you probably would feel like having soup instead. If something hurts, just don't do it. Stop doing it. Try to sleep a little bit on an incline tonight, on your back. And then typically what I do is I have patients come back in about 2 weeks, and I love to look at them. We take pictures and we go ooh and ah at them, and then know that just in the first 2 weeks is just the very, very beginning, because they will just keep working. So for 2 whole years. So in about a month, you should look yourself in the mirror and you should go, oh, I look better. And then another month, you're gonna go, oh, I look better again. And then you'll just be so excited because every month you're gonna be saying that same thing, because these will just keep on making you make collagen. The procedure that keeps proceeding. So, and look at her downtime is gonna be nothing. I mean, she's bleeding a tiny bit, but she's not gonna bruise. And like that, nobody's gonna know. Isn't that great? So if you wanna find out more about PDO threads or about any of the procedures we do at Rejuvenation MD, you can find us on Facebook, Instagram, YouTube, and at our website at rejuvenationmdmedspa.com.